This presentation, titled Complete Blood Count Clinical Decision Support System, was prepared as part of the HAP 752 course on Advanced Health Information Systems at George Mason University, Department of Health Administration and Policy. The presenter, Taylor Galownia, is a student in health informatics, graduating in 2020. The system I created targets the research question of whether a clinical decision support system can help improve quality of care by minimizing medical errors caused by incorrectly analyzing complete blood count test results, while also improving physician efficiency. Analysis of complete blood count lab results can require a great amount of time and attention because there are several factors that need to be considered when deciding what value is normal. With medical errors being a leading cause of death in America, a clinical decision support system that quickly and confidently alerts a physician of what is normal and abnormal is important. My data model involved the creation of a database containing two tables. The first table, titled Patient Data Blood, contains important patient demographic information. Each patient gets a unique patient ID, which is used to join the second table, titled Encounter Blood. The Encounter Blood table contains every patient encounter at a laboratory for blood testing. Each visit gets its own unique encounter ID. These unique IDs are important for lookup. There are four major components to this system: the HTML form that the lab technician enters patient lab results into, the cloud-based electronic health record that contains patient information, including the entered lab results, the applied logic that reads the stored lab result data and indicates what values are normal or abnormal, and the report generated through SQL queries performed by the IT specialist that includes the normal or abnormal listings. It is important to also note that the lab result data with the logic applied is also stored back in the cloud-based electronic health record for further extraction needs in the future. To create the logic, I used a case statement written in SQL to specify the blood element ranges by gender, considered normal by an accredited source. The else statement indicates that any number present that doesn't fall in any of the specific ranges is considered abnormal. These results are stored in a separate table called results blood. The first scenario is of patient with ID 4 who gets their complete blood count blood draw performed on September 8th, 2015, and needs a report indicating what elements of the test are normal or abnormal. The IT specialist would execute the query shown above from the table including the applied logic, which generates a table clearly showing what is normal or abnormal. This table could be emailed or printed to both the ordering physician and patient. The second scenario is of patient with ID 1 who is concerned that their chronic lupus disease is worsening. To help evaluate whether it is in fact worsening, the physician has the IT specialist write a query on the table, including the applied logic, to extract all of the white blood cell counts and results for patient 1 from every lab visit stored in the electronic health record. The results are shown in the table above. This information generated in the table can be further analyzed by creating an Excel graph visually depicting the white blood cell count trend for patient 1. This information can help the physician decide what next steps to take for the patient with worsening lupus. In conclusion, this clinical decision support system aims to reduce medical errors in lab result analysis. It will also help increase physician efficiency, as the need for a physician to sit down and analyze each count in reference to a very specific range will be eliminated. Increasing physician efficiency will likely lead to quicker turnaround for lab results to patients, thus improving patient satisfaction. The system also maximizes meaningful use by utilizing the storable data for trend analysis of lab result data. The sources listed above were used to gather the knowledge needed to write the clinical decision support system logic. This concludes my presentation. Thank you for listening.